Hello, my name is Michelle, and today I will be conducting a deep tendon reflex assessment. So the first thing I will do is I will check provider orders, and once I have ensured that I have the correct patient, I will go to my patient's room and introduce myself. So, knock knock. Hello, my name is Michelle, and I'll be your nurse today. Can I please have your first, last name, and date of birth?
John Smith, July 4, 1984.
Very good. Once I have established and confirmed my patient, my correct patient, I will provide patient privacy and perform hand hygiene. So today we will be doing a deep tendon reflex assessment. And the reason why we are doing a deep tendon reflex assessment is because it is important for pregnant women to have these kinds of assessments done. The reason why we do deep tendon reflexes is to assess the motor neuron and fiber connections throughout the body, and to ensure that everything is going fine. Another reason why we assess deep tendon reflexes is to check to ensure that a pregnant woman does not have preeclampsia or is at risk for preeclampsia. So there is levels of grading. There is 0, which is no reflex at all. There is +1, which is slightly diminished reflexes. There is +2, which is normal, and that's what is expected. There is +3, which is slightly hyperactive, and then there is +4, which is severely hyperactive and can be considered clonus. So one of the reasons why preeclampsia is very dangerous is because it puts you at risk for placenta abruptia, which is a separation of the placenta from the uterus, and that can cause death to the baby and severe harm to the mother. Additionally, you can have a brain hemorrhage because of the elevated blood pressure in the brain, and that would cause death to the mother and baby potentially. Additionally, some of the signs and symptoms of preeclampsia are double vision or blurred vision, severe headaches, heartburn, and right upper quadrant pain. Additionally, severe preeclampsia could lead to kidney failure and could lead to many other disastrous issues within the pregnancy. And if preeclampsia is not treated, it could lead to eclampsia, which is seizures and coma of the mother, which can cause the death of the mother and baby. So I'm going to go ahead and get started. The first reflex I'm going to check is the bicep reflex. So can I have you completely relax and flex your arm a little bit? Okay, I'm going to locate the bicep tendon and place my thumb over it, and then I will strike the reflex hammer. Okay, relax your arm. I will strike the reflex hammer on my thumb. Okay? Okay, one more time. I got a small reflex. I'm going to strike it one more time. Okay, I got a reflex there. The next reflex I will do is the tricep reflex. And I didn't say it before, but the innervation in the bicep reflex is C5 to C6, and the innervation for the tricep reflex is C7 to C8. So this one I will locate the tricep tendon, extend it. Okay, so completely relax your arm, and I will strike the hammer on the tendon. Okay, can you flex again? Extend it. Okay, go ahead and relax. Okay. Okay, I got a small reflex. Okay, I got a small reflex there. The next reflex I will do is the patellar reflex, and this innervation is L2 to L4. So the feet are dangling. Let me go ahead and angle the camera. Okay, so the feet are dangling, and the patellar reflex is right below the kneecap, the patella. So I will strike it. and I got a great reflex there. And it is all reflexes have been +2, which are expected. And then next I will check the Achilles reflex, which innervates L5 to S2, and the Achilles tendon is at the height of the ankle bone of the ankle, so it is right behind the foot. So I will slightly dorsiflex the foot, and when I strike the Achilles tendon, the patient should plantar flex the foot slightly. So I'm going to go ahead and strike the tendon briskly. And my patient plantar flexed. I will do it one more time. Okay, and my patient plantar flexed. And the last reflex I will check for is clonus. It is very important to check for clonus if a woman is preeclampsia or has hypertension. Preeclampsia and the sign of clonus can mean that a woman is at risk for seizures and coma, and a woman who experiences multiple symptoms such as preeclampsia and clonus and hyperreflexuria should be placed on seizure precautions. So when you are checking for clonus, you are going to support the leg so that it is completely relaxed, and you will dorsiflex the leg. Now, this is a negative clonus. If it was a positive clonus sign, when I dorsiflex the leg, the patient's foot, the patient would plantar flex and the foot would bounce when I dorsiflex. So if my patient had a positive sign, they would be bouncing their leg and quivering. So that is extremely dangerous, and any patient that is pregnant who is having a positive clonus should be placed on seizure precautions. So after I'm done, I will ensure my patient is comfortable. I will perform hand hygiene. Do you have any questions or concerns?
No.
Okay, and then I will document everything in my computer. Thank you very much.